Our group is investigating the paired associative stimulation as a treatment option for incomplete spinal cord injury patients. We use a paired associative stimulation, which is the combination of a transcranial magnetic stimulation with non-invasive peripheral nerve stimulation. We were able to show in incomplete spinal cord injury patients that this kind of stimulation, when administered with specific combination of high-intensity TMS with high-frequency PNS, peripheral nerve stimulation that our group has developed, is helping incomplete spinal cord injury patients to recover better in terms of motor performance and independence in their daily lives. For example, we treated one patient when we started over 1 year after incomplete paraplegia. He had one leg which was functioning almost normally, while the other leg was very weak, and he was not enrolled for walking rehabilitation. We were able to strengthen the weak leg with paired associative stimulation so that he could take a few steps and stand on his own. He was then enrolled also into conventional walking rehabilitation, and finally he was able to walk short distances with a rollator. And then when we gave again a second series of paired associative stimulation to this patient, he first improved his walking speed and walking distance. So patients that will benefit the most from this approach are incomplete spinal cord injury patients. So you do have to have some spared connectivity in the spinal cord to be able to benefit from it. And the shorter time it is from the injury, the better. And of course, the more severe the injury, then the more difficult it is to achieve results. But it is also possible, but with longer stimulation times. So in general, we have stimulated over 20 chronic patients before and published this data as case reports and case series with nice improvements in motor performance in these patients. And our latest news is that we have conducted a randomized controlled double-blind study which will be published next year. The follow-up is not yet complete, but it looks promising, but I am not able to tell the exact results just yet.